You know, lung cancer is the #1 cause of cancer deaths, accounting for almost 1 in 4 in the U.S. Smoking, of course, the main factor. The sooner that cancer is diagnosed, the better for the patient. And that means screenings. But some people were not able to get screenings for lung cancer. But now there is a federal rule change that may make that possible for more people. Joining us this morning is Dr. Ruben Naba, a Washington University physician at Siteman Cancer Center, to talk about it. Good morning to you.
Good morning, Randy. Thank you for having me.
Of course. First of all, let's talk about that rule change. It has to do with Medicare coverage and what screenings they will cover for smokers and former smokers. What can you tell us about that?
Yeah, Randy, this is a very important decision by the Centers for Medicare and Medicaid Services because, as you mentioned, not only broadens the screening of patients with have risk for lung cancer, but also increases the coverage of lung cancer screening with low dose CT scan of the chest. This decision also streamlines the decision making and counseling of these patients.
So do you expect this change to save lives, doctor?
Yeah, so as you know, as you mentioned, also the lung cancer is one of the most lethal cancers, not only in the United States, but in the world. So the goal of any screening test is to early detection, treatment, and therefore, at the end of the day, saving lives.
And what about people who have employment health plans? Are they covered through that as well, or is it just the Medicare changes?
Yeah, so this is an important change because it will allow for other, not only Medicare, but also other providers for healthcare for patients to be covered. So this is expanding not only the coverage for Medicare, but for also other providers for cancer screening.
And doctor, we do understand that lung cancer can strike non-smokers as well. Are these screenings applied to that as well?
Yeah, so that will have to be a shared decision making with your primary care physicians. At this point, those patients, as I understand, are not going to be covered. Mm-hmm. But if you have a conversation with your primary care physician about the risk that you have, I think you can have a chest CT scan of the to see if there is a nodule that needs to be followed or treated.
Understood. And you did mention the risk. I understand that Siteman has an online tool that anybody can access to assess their risk. What is that about?
Correct. So there is an assessment risk tool that everybody can use and put in information to screen themselves and then talk to their primary care providers, including primary care physicians, MPs, and physician assistants to see if they are eligible for lung cancer screening.
All right, and that site is called yourdiseaserisk.com. Dr. Nava, thank you so much for being with us this morning, and we are going to make sure that our viewers have access to all of those sites that you mentioned, more about this new federal program and that online tool to assess their risk for lung cancer. Thank you so much for joining us.
My pleasure.